Thank you. Every day my grandfather says, Bangalore used to be so cool and so beautiful. Every day I hear the news person say, today is the hottest day in history, and then he says it again the next day. Don't you also feel stressed and worried about the future? Because I know that I do. We need climate action now because climate change is disrupting the conditions known to support good mental health, including socioeconomic, cultural, environmental conditions, and living and working conditions. And this is felt more acutely in disadvantaged populations. Welcome to our session, Climate Change and Mental Health, New Perspectives and Principles for Addressing Increasing Need for Mental Health and Wellness in the Context of Climate Change. Through this panel, our experts will elaborate on how we can address the need for improved mental health and well-being in the context of climate change. Our first speaker is Dr. Guinto. Renzo Guinto is an associate professor at Duke-NUS Medical School, National University of Singapore. He's unfortunately unable to join us in person and was kind enough to record a Firestarter and share it with us. Over to Dr. Guinto for the opening remarks and to set the context.
Thank you very much for this opportunity that you have given me to contribute to this important conversation. I come from the Philippines, a Southeast Asian country with more than 7,000 islands located in the Pacific, a country that is year by year ranked as one of the most climate vulnerable in the world. I'm sure each year you see in the news that the Philippines is hit by multiple strong typhoons and intense flooding. These extreme weather events are now increasing in frequency, severity, and magnitude because of climate change. But more recently, the Philippines, along its Asian neighbors, was hit by a regional heat wave for weeks, which is unprecedented in our modern history. Our communities, our public health systems, our entire societies were caught unprepared. For us, this is a new, unfamiliar threat. Today, we all acknowledge that climate change is a health issue. It affects every organ system of our body, every aspect of our individual and collective health, and every social determinant of health. And it is not only a physical health issue, it is a mental and emotional health issue as well. Climate change affects the health of our brains and hearts. We Filipinos are all too familiar with the mental health impacts of typhoons, floods, and landslides. For instance, people who are forcibly displaced from their homes do experience post-traumatic stress that can last for weeks or even linger for a lifetime. But we are also now observing the emergence of more subtle yet long-term psychological responses to climate change, such as the new phenomenon called climate or eco-anxiety. In fact, a 10-country cross-sectional survey published in 2021 revealed that the young people of the Philippines are the most climate anxious in the world. In my visits to coastal communities in the Philippines, residents are already expressing their worry and fear as their fish catch continues to decline and as they witness their houses and farmlands being devoured by the sea. With these emerging evidence and stories that portray the linkages between climate change and mental health, we, the health community, can no longer just focus our adaptation and resilience measures to physical health issues, although there is still a lot to be done to quote-unquote climate-proof many of our disease prevention and control programs. But we must also ensure that building resilient and responsive mental health care systems, not only the management and treatment, but also prevention and promotion, is part of the broader climate resilient health system agenda, for instance, as being advanced by the newly established ATTACH program led by the WHO. Moreover, part of mental health resilience building, even in the face of a warming planet, is to ensure that we create and sustain healthy societies where people enjoy basic rights, have access to resources for living, thriving, and flourishing, are protected from disinformation and discrimination, and live in solidarity and peace. The Climate Mental Health Nexus is a new arena for inquiry and action. More research needs to be done. I hope that more funders, especially those in the audience, will prioritize this intersection. Good thing, early efforts are now underway. For example, I am part of a research project funded by Welcome called Connecting Climate Minds, which not only develop regional and global research agendas on this issue area, but also created regional and global communities of practice that bridge disciplines, sectors, geographies, and even generations. In the Philippines, we are beginning to study not only the epidemiology, but also the lived experiences of communities that are already facing the mental stress, even trauma, resulting not only from extreme events, but also the slow onset changes that are unfolding in front of their very eyes. And we are doing this by embracing a truly transdisciplinary, cross-sectoral, community-engaged, and even decolonized approach. Because, for instance, climate anxiety among youth in the UK, reading about climate impacts elsewhere, is not the same as climate anxiety being experienced by young Filipinos who, after a powerful typhoon, have lost their homes, their family, and even their hopes and dreams. Finally, we must remember that addressing the mental health impacts of climate change is not only an adaptation and resilience imperative. Climate mitigation, decarbonization across all sectors, such as energy, food, and transport, is very much an integral part of our collective response to the impacts of climate change on mental health. Pursuing this route will enable us to reap the health co-benefits, not only physical, but also mental and emotional as well. I hope that all of us will demand our governments to honor their climate commitments, because accelerating climate mitigation is mental health promotion and prevention on a planetary scale. Thank you.
Thank you, Dr. Guinto, for your remarks. Since you mentioned about connecting climate minds, YOUNGO was also part of the Connecting Climate Minds project, where we also did a global youth survey, and individually, we had the Rising Resilience Stories, which happened in Global South countries, and India participated in that. And it's very astonishing to see the different kinds of mental health impacts that happen across sectors. But more about that later. Now we have with us our panelists for today. We have Nqatyiswa and Nikki Mendu, who's in the audience. Nikki. Dr. Nidhi Nagabhatla, who is online with us, and Dr. Gary Belkin. Dr. Nidhi Nagabhatla is a senior fellow and cluster coordinator at UNU CRIS, who focuses on the intersection of climate change, natural resources, and health. Her work addresses water-related health impacts such as mental health issues from water, food, and energy insecurities in the context of climate change. She is actively involved in the UN Decade of Ecosystem Restoration, contributing to health and environmental governance initiatives, and was the lead author of the Global Assessment of IPBES. Nidhi, what are the enabling factors for addressing the intersection of climate change and mental health? How do we direct research, targeted interventions, and integrated policies to help mitigate these impacts and promote resilience and well-being across diverse populations and gender groups? Nidhi?
You can hear me and you can see me, so with that assumption, I'm moving forward with my intervention. Hello everyone, very happy to be at least digitally present to to share some of the insights from the work that United Nations University as the UN think tank is conducting on the nexus between climate change and health, and in particularly mental health. I'm heading the program on nature, climate, and health. So that's very evident that we have put health very much as the part of investigating the nexus between climate change and nature. And I'll explain some nuances of how we are moving ahead with assessing the trends, patterns, but also gaps and needs in understanding the climate change mental health nexus within the larger scope of climate change discourse, policies, action, and agenda setting. Having said that, maybe let me also put this point up front that it took us at least 27 COPs to acknowledge the health agenda in the mainstream stage, in the main stage. And I think that already sets us on a promising pathway, that there is enough acknowledgement. People, states, agencies, experts are reckoning the connection, increasing connection between climate change and health, and also mental health and psychosocial well-being. In terms of this very critical nexus, the impacts are direct, indirect, and also on the so one is the mental health, but also psychosocial well-being, the performance of an individual in a full form on a daily basis. But there are also elements of socioeconomic disparities between global north and global south, vulnerable populations within and across global north and global south, not necessarily just in global south. I will give an example of my work in the Canadian native communities, and that also brought to the forth how kind of there are certain indigenous aspects to this mental health explanation, specifically with communities, native communities exposed to climate stress without even understanding how that has happened and has disrupted their social cultural context, the identity crisis that they are facing, which is putting a double burden or a triple burden in terms of the climate change, mental health nexus and their exposure. The social political environment wherein the social contract, the welfare systems in countries and communities where it's not very well defined, it's not really committed to in terms of financial, technical, and human capacity. The health systems are already suffering. So the added burden on these systems. These are some of our entry points to understand the climate change mental health nexus. But let me give you two very specific examples. One of the European floods of 2021. This was the first time that the world looked at the developed countries where the flood victims reported and explicitly reported trauma, anxiety, depression of having subjected to the flooding incident where the countries not only faced the losses amounting to billions of euros, but lost more than 300 lives. The damage across, the destruction across the region, the communities stayed for months. We have been conducting immediate, short, and medium term study, 1 year, 6 months, 1 year, 2 years, 3 years, on how people have been traumatized by the incident and what kind of services are available, which were a part of response and recovery, but then in a medium 6 months to 1 year to 2 years, are these services even available to mitigate the long-term trauma from exposure to this event? And we learned that people feel much more trauma, much more despair after they were exposed to the incident, especially the group that saw the incident firsthand, that lost someone dear to them, that lost a family or a friend who lost life, that saw their grandmother's house turning into a kind of rubble. So these incidents stayed with them. Educated people who had to resign from their job to take some help in recovering from that trauma. So this we're talking about from a developed world case study. You can see the contrast in developing world cases from Bangladesh, from other countries, evidenced by literature, information and knowledge, projects and activities that have put forth information that there is still a lot of social stigma in acknowledging mental health related to climate change impacts and disasters. So that contrast is something also we are looking into. Take again a very quick mention of the Canadian First Nation communities, the Indigenous communities living in the Ontario region of Canada. And these people, we worked with the government project for 5 years looking into the case of eco-anxiety, climate anxiety that they are facing because of the loss of identity. There are 500, more than 500 warnings of what you can't do with the water around you, what kind of things that were a part of your culture, like going for fishing, is not anymore an option, like going for kayaking because of the change in climate, the hydrological flows that have been impacted, the pollution, the air quality, the water quality. So all these cumulative impacts have resulted in sort of a depression in loss of identity or social cultural identity. And this is a very, very distinct impact on indigenous communities in Canada, but we have learned examples that this might be similar for communities in US, in Australia, in New Zealand, and many other parts of the world that share a deep relationship with nature, and where ecological degradation and climate change impacts have together have caused them to reflect that they have to change their cultural practices, and the mental and the social well-being of communities are compromised. But I think I don't want to conclude in a pessimistic tone, but I would say that the countries have also geared up in straightening out, in revising, reforming their national adaptation plans. I would give an example of Canada's national adaptation strategy that stresses on human health dimension, on stating that climate change hazards and acknowledging that these hazards have worsened the existing mental health illness and impacted mental well-being, or disrupting the sense of community safety and connection. And there are measures put in place for monitoring, for data collection, for generating evidence, to design solutions, to deploy community level interventions to mitigate these impacts. So yeah, I think diagnostics and solutions are going hand in hand, presenting us a promising pathway to collectively address this nexus. Thank you.
Thank you so much, Dr. Nidhi. I think that was very insightful. Something that's been echoed by two of our speakers so far is that the loss really changes us as humans, and the trauma is real. We've been talking about a subtle change in PTSD and stuff. But what I also hear is, on a more hopeful tone, is that sometimes it also teaches us how strong we can be and the need for us to build resilience. Especially since we brought up indigenous communities and culture, I would like to go to our next speaker, which is Nqatyiswa, if I pronounce that right, and Nikki Mendu. So Nikki is a member of the arts studio Invisible Flock as the engagement and communications coordinator for the land body Ecologies. It is a welcome-funded, transdisciplinary global collective of artists, designers, researchers, expert communities, and activists who are exploring the environmental changes impacts on mental health. Nikki is a facilitator, social change practitioner, and communications expert who is passionate about the role of creative methodologies, transdisciplinarity, and dialogue in social change. She holds a particular interest in meaningful exchanges through art and in the fields of environment, human rights, health, and gender. So Nikki, preparing communities for current and future climate threats requires an understanding of psychological barriers, enablers of climate action, and what helps people to live through these crises. As has been mentioned, our culture also forms a very vital part of our identities, and losing our culture means losing our identities. And because it's a part of our identity, I feel like it weaves very intricately with how we respond and how we are resilient to what we face. Could you share some practical examples of this role of culture in building resilience?
First of all, thank you very much for the opportunity to be here. It's been really valuable to hear from all the speakers and conversations. And perhaps before I provide a practical example, to share a little bit more about the Land Body Ecologies Research Network. We are a transdisciplinary network, as you mentioned, Harshita, specifically looking at solastalgia. And I think it was great to hear Nidhi and Renzo mentioning eco-anxiety. And solastalgia is another fairly new field that came up in the IPCC reports fairly recently. And the environmental philosopher Glenn Albrecht defines it as this feeling of homesickness when you're still at home, but your environment is changing around you. We explore this concept specifically working with land dependent and indigenous communities living on the front lines of the climate crisis and experiencing environmental change. We work across 6 international hubs, which I think is always important to highlight. So made up of all independent organizations. We have the Ban Nong Tao Hub in northern Thailand, led by Lazy Man Coffee. The Windy Hub, led by Action for Batwa Empowerment Group in Uganda. The Banagata Hub, led by Quicksand Studio in India. The Arctic Hub, led by University of Ulu. And then the London Hub, where we are currently based in the Wellcome Collection. So in terms of going back to your point about culture, I think it might be helpful to provide a definition for culture as well. So I'll look to UNESCO's definition in 2001. They described culture as something that all humans have, share, and rely on for making meaning. It's a set of maybe emotional, intellectual, or material principles that go beyond maybe the national, religious, or racial. And I found quite a beautiful example in a policy brief on why culture matters from the World Health Organization when it talks about a river. And it says, the same river could appear to different people as different things. So some people might see a river as a place for conversation and for exercise. Some might view it as a place for waste disposal or for lucrative development. It could also seem a place for shared memories and cultural histories. So leaning into our work at Land Body Ecologies, I'd like to share 2 examples. And the first, I'd like to acknowledge with thanks the blessing I received from Daniel Kabe, the CEO of Ogiek People's Development Program, which is a land rights and human rights organization in Kenya. And that is to share the example of a cultural center. So in much of the literature, cultural centers are incredibly important for indigenous communities, specifically thinking around community resilience, as was mentioned earlier. They are sites for the transfer of knowledge across generations, sites for land rights, acknowledgement and agency, and sharing traditional practices and ways, and I think also climate change adaptation. But what is important to highlight is that all of these are determinants of health. For many indigenous communities across the world, there's a very close connection between land and body, which we could describe as an almost embodied sense of place. And if in a conversation like if I had to speak with Daniel, he might describe Ogiek culture as like health and culture are one. So I think this is just kind of a practical example. As part of one of the LBE initiatives, OPDP led the building and the construction and the opening of the center. So this is like a physical manifestation of a place where the community can have years of a place for their own resilience in the climate change adaptation discussions. And then secondly, I'd like to share an example of the role of culture in advocacy spaces, specifically thinking around climate change and mental health. And that's the example of both the COP27 and COP28 conferences, where the LBE team members in Visible Flock, as well as our wider team, held a presence. Some of you may have attended these conferences and you will have seen a giant sculpture in the World Health Organization Health Pavilion. I tried to get a picture up today, but it wasn't possible. But it basically resembled a 6.5 meter long sculpture that resembles the shape of human lungs whilst taking the shape of trees colliding. And this sculpture was a way to make the link between planetary health and human health quite evident. And I think is just another important example of the role that culture and the arts can have in places like COP on policy discussions to bring wider perspectives and show, like, it nurtures empathy and it appeals to all the senses. And I'd also like to add that within that space at the World Health Organization Pavilion and designing it, all the other artworks that were presented were all artworks by global artists currently experiencing the mental health impacts of environmental change. So it's another way to platform these different perspectives, which are not always in the spaces where these conversations are held. I think maybe I'll pause on that for now, but I'm looking forward to building on the conversation. And also want to just add, in the lobby area, you'll see there's a video by Ogiek People's Development Program, which shares the Cultural Center building. So I encourage you to check that out. Thank you.
Thank you so much, Nikki. Just echoing on what you mentioned about the pavilions that were present at COP. How many people here have been to COP? Please raise your hands. How many people have seen Indigenous people in their attires or have seen the WGC pavilion, the Women and Gender Have you seen the murals? Does that give you a sense of belonging, a sense of community? I feel like that is so very important, especially when we talk about mental health, because sometimes just knowing that, hey, I have somebody whom I can talk to this about just makes all the difference. So I'm so glad that you brought up that intersection and how art is actually shaping the way we feel and breaking the barrier to actually talking about these mental health issues. Next, we have Gary Belkins. Gary is the director of the Billion Minds Institute and an assistant professor at the Columbia University Mailman School of Public Health. He's a psychiatrist who approaches mental health as a building block of social policy and progress. He's also the former executive deputy commissioner in the New York City Department of Health and Mental Hygiene, where he led the division of mental health hygiene and its development and implementation of the innovative NYC-wide public mental health initiative, Thrive NYC. Gary, how can we effectively integrate mental health considerations into climate adaptation strategies in a global north country like the US, and how is it different in regions like sub-Saharan Africa and the Caribbean? Could you also share examples of successful initiatives and discuss the importance of viewing mental health as a foundational aspect of social resilience in the face of climate challenges? Over to you, Gary. Gary, I believe you're on mute.
Yep, sorry about that. And apologies I'm not there. COVID has descended on my household over the weekend. I plan to be there, but great to be talking to you all. I mean, the first answer to your question is how do we do it, is first acknowledging that we have to do it. And just really echoing and maybe putting a bit finer point on what the prior speakers have said is that, you know, I've been in mental health policy at global and local levels for a long time and regularly see when we settle for a small version of mental health change rather than a big version of mental health change. Small version being, yes, there's more of this kind of morbidity, we have to care for it more, we need some more treatment capacity, but it's sort of boxed into a corner. The big version is acknowledging that mental health and emotional well-being is one of our biggest projects in the Anthropocene, that it is the backbone for our societies to problem solve, to sustain social ties, collective and individual agency, that it is undergirds health, that it undergirds social capacities of many types, that it's the fuel and the casualty of whether communities are violent, whether communities are economically vibrant, of whether social fabric sticks together. And so we have to treat it that way, and we have to be intentional about acknowledging that it's that big. When I look at these emission curves, you know, these steep curves about how fast at the rate we need to reduce carbon emissions to fall between temperature increase ceilings, I see huge social change curves. These are social stress test curves that's sort of colliding of damage and transitions that have to happen at such a pace and rate is fairly unprecedented. And that requires resilient people. And so we have to take climate adaptation and resilience and approach it with its deep psychological meanings and tools and solutions of human adaptation and psychological adaptation and resilience. We talk about Earth's tipping points, those places we go beyond where we can't dial back if we lose certain ice sheet mass to reflect heat. But there are also social tipping points. I was on a call with some colleagues in India, psychiatrists, who were talking about heat waves now that is really now not waves, but relentless new conditions. about what, we're actually talking about what do we do when there's mass hopelessness. So there are social tipping points where hope gives to hopelessness, where a social fabric unravels, and that is super hard, as we've learned through COVID, and we're still living through COVID, to dial back once that gets undone. And we're not going to do local-led adaptation. We're not going to have no more malaria. We're not going to address heat if we don't really get ahead of taking care of and bolstering the social fabric and look at those the social climate curves. So how do we do that? So I've spent most of my career as a public health psychiatrist and a policy person in positions of policy making and so forth, in thinking about how to do that. How do we implement in ways that treat mental health as a key community asset, as something that's cultivated and strengthened? And the short answer to that are two things. One, we look at the entire psychological toolkit, what we know about human behavior, how to nourish it, how to change it, how to steer it, how to repair it, and understand that what it helps us do are one of two tasks. It helps us care for each other, and there are tools that help us be greater bearers of collective change. And so we need to apply those respective tools where they're needed, and so see community mental health in this enlarged version as a communal project. So when I was the New York City Mental Health Commissioner, what we did is took a lot of Global South derived knowledge. By the way, most of this research about how to do community mental health differently has come from the Global South, and a lot of work that I've done there in sub-Saharan Africa, the Caribbean, that includes evidence that shows most of the sorts of things that people come to professionals for can be skills that lay people, non-professionals, can do most of the work, from care of people who are suicidal to promotional, positive mental health strengthening, psychological resilience building interventions. So one is we have to work that way and supersize working that way. And then another is to bring all of government into the picture. This is not just for the health department, this is not just for the mental health department. The community as the place of mental health acceleration and is all departments. So we did two things. We created a Transgovernmental Council on Mental Health that has now stayed in our city charter as the Community Mental Health Office of the Mayor, that brought together 24 city agencies, because you need urban planning, you need economic development, you need all the child-facing work and convening power of government, our school systems, our care systems. And you also need government to be part of bringing civil society together to really go down this road of skilling up community members. So we invested quite a bit of resource in daycare centers, in our school system, in shelters for homeless people, in our faith communities. These are the front lines of mental health care and promotion and resilience building. And so they should be treated as the front lines of that and skilled and supported to do so. So we really were intentional about building an architecture of care. If I could show you a diagram, which I think is on your app, there's a map of geolocated locations where we did this skilling and capacity building of all sorts of community spaces and places. I think there are several thousands of these dots on this map that show places that were not mental health clinics, where that were becoming the front lines of mental health promotion and social climate building. And so we need to propagate those maps globally. I'm now part of an effort that essentially is trying to do that. So I was mentioned forming the Billion Minds Institute. It's a small think tank, and it facilitates a network we call the COP Squared Network, Care People Times Planet Network. Now about 460 organizations that have signed up, seeing themselves as ground game, part of the ground game army to drive this kind of change. Renzo, Guinto, who you heard from, is our West Pacific and South Asia regional hub lead. Connecting Climate Minds group that was previously mentioned, that worked with Welcome to try to develop a research agenda in this area, is Imperial College London, which is our European regional hub lead. So this is a real growing network, but focusing on implementing what we know how to do, like the models that I mentioned and the basic paradigm that I described for New York City. We were able to get the attention fairly quickly of the UNFCCC Climate Champions team, particularly the Race to Resilience effort, which is a huge effort to mobilize global action to grow capacity for climate adaptation, where the most climate affected regions are, where 4 billion people live. And so we made the bet that we could develop a strategy how that kind of massing of civic effort, of global effort around climate adaptation, that we could design a strategy for how to, within that, integral to that, not a separate lane of work, but integral to that, building on the ways they were bringing communities together and reaching, and the infrastructure for implementing, that within those we could also have any of those efforts also advance capacity building for psychological resilience across the toolkit and across sectors, and so we're now putting that to work.
Thank you so much, Gary. That was very insightful, and something that all four speakers actually have echoed is about human adaptation and psychological resilience, about the need for knowledge transfer, education, awareness, and capacity building, and an overall holistic collaboration that we don't want just mental health experts or healthcare professionals, but we need everybody to be speaking about this. Before we go to closing remarks, I would like to let our speakers and the floor know that we are open to questions, and we do have one question. In the interest of time, I would like you to answer the question in one word. All right, and it's going to be challenging, but let's try. And then we'll have the key takeaways, one per each speaker, and we will close the session. So the question is, who is missing from the climate mental health conversation? Which sectors would you like to invite to invest more time or resources to the climate mental health work? Maybe we can start with you, Nikki.
Say one word.
Yes, one word for each question.
Okay. Say marginalized communities, which is very broad and encompassing. Yeah, and that's not your one word, but and
where would you like them to invest?
I would say the recognition of culture as a human right. Yeah, it's come up in the SDGs, and if you're in the coffee area later or online, you can find my email. I've got lots to chat about that. So.
Okay. Dr. Nidhi, what would be your answer?
I'll say innovators. Let's put AI to good use.
Okay, no Terminator massacre happening. We're putting it to good use. All right, Dr. Gary, what do you say?
Finance. We have to measure psychological loss and damage and treat it as the huge investment and cost that we take seriously. Otherwise, we won't take it seriously.
But can you really put a price on someone's psychological distress and trauma?
Absolutely. We actually, there are countries and treasuries and finance systems currently use subjective well-being measures, morbidity measures, and can put a price tag on it. We talk about non-economic loss and damages as if these we cannot capture and we cannot compensate them in ways that are very specific for the damage they are causing.
All right then, so maybe that's something for us to push with our negotiators in the loss and damage to actually finance this. But did you guys know that 0.5% of climate financing is what comes to health financing? And when you bring that towards mental health, or even less spoken about conversations, you brought up marginalized communities, I think conversations around gender and how they acutely feel it, for example, the LGBTQI community, I don't feel like they're a lot of times considered in these conversations as well, and it would be interesting to note that. And if I want to ask somebody to invite or invest in more resources or time, I would say prioritize grassroots level organizations and the work that they're doing and the adaptation strategies that they're doing. For example, YOUNGO last year, we had 20+ side events at COP28, and we had almost 5 to 6 of them based on mental health. And these weren't just where we were discussing about mental health impacts, but we were we had workshops. We did sharing circles, we shared snacks, we did a bit of yoga, we did dancing, we made a Spotify playlist, we did any and every possible thing just to find that sense of belonging and community. And also, since the Connecting Climate Minds project was mentioned, that also helped us find, our sense of belonging. Something that I'd also like for all of the parties and members over here to consider is about the fact that YOUNGO is this time trying to bring care spaces to COP. One of the things that we see at climate conferences, even though like negotiations are extremely frustrating, but it's also the fact that it just drains us emotionally, mentally. It's always so taxing to have these very difficult conversations about loss and damage, how it's impacting our everyday lives. So we envision, and we're trying to talk to members and parties and civil society organizations to have a dedicated care space where anyone can be emotionally vulnerable and find that sense of community and belonging and feel together. So if anybody over here is interested in that, my name is Harshita, and you can reach out to us, and we are YOUNGO Health. To end this, I would like to say finally just one last sentence, and that is, we need to remember that we are all connected and that everything is interlinked. A healthy mind is equivalent to a healthy body and is equivalent to a healthy world. Thank you.
Thank you, Dr. Harshita and dear panelists. Next, there is another panel. But before that, I want to announce a profile in climate resilience.
In 2022, heavy monsoon rains in Pakistan caused catastrophic flooding, which destroyed homes and facilities and displaced millions of people. The flooding had severe impacts on people's health. Flood damage to water and sanitation system forced people to rely on contaminated water from ponds and wells, increasing the risk of waterborne diseases. The flooding was the worst in Pakistan's history, but there may be even worse to come. The 2022 flooding has been conclusively linked to climate change, and as climate change accelerates, flooding may become more frequent and more destructive. But there are things we can do to prepare and to help keep people healthy. My name is Burhanullah, and I'm working with International Medical Corps in Pakistan. I am from Mardan district of Pakistan, and I joined International Medical Corps in October 2022. Over the past year, my colleagues and I have been working with communities and local governments to develop climate resilient and water and sanitation system for villages in the Shaheed Benazirabad district of Sindh province. We are rehabilitating water supply system, making them more resilient to flooding. And we are building toilets that are less likely to flood and release sewage and diseases into the environment. But our work goes beyond the flood-proof structure. We also collaborate with community leaders to help them spread messages about climate change and how to stay safe when flooding or other climate-related disasters occur. By ensuring access to clean water, improving sanitation facilities, and empowering local leaders, I am able to serve my community and inspire lasting change. Maybe we can't stop the flooding, but we can make sure that when it happens, people know what to do and have clean water to drink.